you believe you're having angina chest pain or any other type of chest pain emergency, please click the video link being shown on top of the screen in this video right now. In this video, you'll learn about the types of healing supplements that you can use for finding angina chest pain relief using non-toxic natural health home remedies for chest pain. This information can help you with creating your own safe, effective chest pain treatment, combined with some of the other chest pain exercises and natural health home remedies for chest pain presented in the video series. You may be able to minimize your reoccurring chest pressure and pain, or possibly even eliminate them. It's important to be aware that using any of these natural health home remedies for chest pain should not be considered a replacement for seeking a trained and licensed doctor or healthcare practitioner. If you're using these remedies and your angina pain persists, you should immediately seek medical help. First, it's important to understand that pharmaceutical medicines that are prescribed for angina either relax and widen arteries so that more blood can flow to the heart, or they try to reduce the workload of the heart. You'll learn right now about 5 different healing supplements that can also help your heart in similar ways. All of them are used for many other serious conditions as well. Links to any studies that I mentioned could be found under this video. Coenzyme Q10, or CoQ10, is a vitamin-like substance found throughout your body, but mostly in your heart, liver, kidneys and pancreas. CoQ10 is often used for heart failure, chest pain and high blood pressure. Some research studies have shown that taking CoQ10 might help reduce some symptoms of heart failure. Coenzyme CoQ10 is most likely safe for most adults when taken by mouth. Some mild side effects could include stomach upset, loss of appetite, nausea, vomiting, and/or diarrhea. It might also cause allergic skin reactions for some people. It could also possibly lower blood pressure. Taking smaller doses a few times a day instead of one large dose can help reduce any side effects that you might experience. Children, pregnant or breastfeeding women, people who are undergoing chemotherapy, planning surgery, or who have blood pressure issues should consult with their doctor first before using CoQ10. L-arginine is used for heart and blood vessel conditions like congestive heart failure, chest pain, high blood pressure, high cholesterol, heart surgery, recovering after a heart transplant, heart attack, and coronary artery disease. L-arginine is converted in your body into a chemical called nitric oxide. Nitric oxide causes blood vessels to open wider for improved blood flow, and this is the basis for how nitroglycerin, which is often prescribed for angina chest pain, actually works. Taking L-arginine seems to decrease angina chest pain symptoms and improve exercise tolerance and quality of life. According to some studies, taking L-arginine by mouth also seems to prevent nitrate tolerance from developing in people that are taking nitroglycerin for chest pain. L-arginine is possibly safe for most people when taken appropriately by mouth short term. Possible side effects are abdominal pain, bloating, diarrhea, gout, blood abnormalities, allergies, airway inflammation, worsening of asthma, and low blood pressure. Children, pregnant or breastfeeding women, people with allergies or asthma, liver cirrhosis, GAMT deficiency, herpes, blood pressure issues, recent heart attack, kidney disease, or who planning surgery should consult with their doctor before using L-arginine. L-CARNITINE is an amino acid which can help relieve angina symptoms by providing your heart's muscle metabolism. L-carnitine helps the body produce energy and is therefore important for your heart and brain functions, muscle movement, and many other body processes. Taking L-carnitine orally seems to improve exercise tolerance for people experiencing chest pain. Taking L-carnitine alongside medical treatments also seems to help reduce chest pain and improve exercise ability in people with cardiac syndrome X. Children, pregnant or breastfeeding women, people with hypothyroidism, or who experience seizures should consult with their doctor before using L-carnitine. N-acetylcysteine is one of the amino acids which are the building blocks of proteins. N-acetylcysteine has many uses as a medicine. N-acetylcysteine is used to alleviate a vast array of very serious conditions and is an extremely important supplement to consider for angina chest pain because the other health benefits are many. Healthcare providers give N-acetylcysteine for chest pain in combination with nitroglycerin, or for heart attack in combination with nitroglycerin and SK. Taking N-acetylcysteine orally or by IV seems to improve chest pain when used with nitroglycerin. N-acetylcysteine is most likely safe for most adults. Possible side effects include nausea, vomiting, and diarrhea or constipation. Occasionally it can produce rashes, fevers, headaches, drowsiness, low blood pressure, or liver issues. Children, pregnant or breastfeeding women, people with acetylcysteine allergies, asthma, bleeding disorders, or who are planning surgery should consult with their doctor before using N-ACETYL-CYSTEINE. Arjuna is the bark of a tree and has been used in traditional Ayurvedic medicine to balance the three doshas, Kapha, Pitta and Vata. It has been used in India for more than 3,000 years, mostly for heart remedies. Terminalia contains ingredients that help stimulate the heart. It might also help the heart by lowering cholesterol and blood pressure. Modern scientific research on Terminalia arjuna has been going on since 1930s, and some studies have shown positive results. Its use for heart disease is still being explored by medical science, primarily to understand the mechanisms by which it works as it does. Some research has shown that taking Arjuna along with medications can improve symptoms of angina chest pain. There are two other Terminalia medicinals, but these are usually used for high cholesterol, digestive disorders, diarrhea, constipation, and indigestion. Arjuna is possibly safe when taken orally for 3 months or less, but please consult with your doctor before using this because it might affect your heart. Children, pregnant or breastfeeding women, people with bleeding disorders, diabetes, or who are planning surgery should consult with their doctor before using Terminalia arjuna. It's important to be aware that using any of these natural health home remedies for chest pain should not be considered a replacement for seeking a trained and licensed doctor or healthcare provider. If you're using such remedies and your angina pain persists, you should immediately seek medical help. However, even if you have more serious chest pain or chest pressure issues requiring a medical doctor's assistance, you may still be able to use these natural health healing supplements as a supportive chest pain treatment, right along with whatever your doctor wants to do with you. Just be sure to ask your doctor first. Be sure to subscribe to my channel, like this video, and click the bell icon so you'll be the first to know whenever I add new helpful videos for you to watch. I've placed links below this video to our core team of professional natural health practitioners too. These are trained and experienced experts that can help you with any health, physiological, psychological, and/or emotional issues that you or a loved one might be dealing with. You can also work with them in a complementary way right along with your medical doctor.